Thank you so much for joining us. My name is Laura Burbano. I am the admissions advisor for the clinical mental health counseling programs and the sport and performance psychology programs. And so today we're just gonna go over the clinical mental health counseling programs. We offer Masters of Science in Clinical Mental Health and also a combined doctoral degree in sport and performance psychology with a specialization in clinical mental health counseling. So thank you for joining us. So before we start, so I believe it's very important for you to know exactly what's going to happen today. So basically, we're going to have an informal conversation with faculty members and the program director of the Clinical Mental Health Counseling Department. So we have, to that extent, of course, Dr. Michelle Cox. She is the program director of the Clinical Mental Health Counseling programs. And we also have Dr. Patrick Davis and Dr. Amy Ohana. So if they can please go ahead and join me, that would be wonderful.
Hi, everybody. Thank you.
Hello, everyone.
Great. So we're just going to start right ahead. And I believe some of our participants would like to know a little bit of each one of your roles. If you're teaching a particular class in our master's program or in our doctoral degree in sport and performance psychology, it would be wonderful if you can tell us the name of the class and also like what you do to make it interactive.
Dr. Davis, are you going to go first?
No, I'm going to let Dr. Ohana go first. Ladies first.
Well, thank you so much. So it's lovely to be here. Everyone, welcome. For those of you who are attendees today, as well as those of you who might be watching this online. I am the newest faculty member in clinical mental health counseling. I'm beginning my 18th year as a full-time counselor educator. I've done this for a while. I'm so excited to be at UWS because I think that this university is leading the edge in innovative and integrative practices in counseling with other disciplines like sport and performance psychology. I am teaching 4 classes this quarter. I'm teaching a section of clinical internship, which I love teaching internship. I've taught internship for a long time. That means that my students are placed in locations where they live, and most of them are on the East Coast, and we meet once a week for 90 minutes and we talk about cases. We watch videotape of clinical work, and we'll talk about how we do that ethically and legally today in our webinar. And I support them in their treatment planning and their diagnostics and in their assessment of the client. I'm also teaching counseling methods and practices, which is one of the first classes that counselors take in their learning their clinical skills. I'm teaching counseling theories, and I'm teaching career counseling. Career and vocational counseling is a passion of mine, so it's fun to teach it. So now I'm going to turn it over to, I'm giving it back to Dr. Davis.
Hello to you all. It is nice to virtually meet you. It would be nice to see your little faces or big faces. I am Patrick Davis, and I have joined the faculty at UWS in January and served in the role of a counselor educator for a while. This term, I'm teaching multicultural counseling, internship, and a group counseling course. And candidly, I enjoy teaching all the classes in the counseling program. And so I'm very passionate about the work that we do. I think it's a vocation, like a calling, and we have an opportunity to do great good in the lives of other human beings. So it's nice meeting you all, and I look forward to meeting you all again in person or on Zoom perhaps one day.
Thank you both. And I'm Dr. Michelle Cox. I'm the director of the Clinical Mental Health Counseling Program and designed the program from the ground up 3.5 or a little more than 3.5 years ago. I'm super proud of it. This is my 17th year as a full-time counselor educator. And I'm super excited to just keep finding and being able to woo such great faculty to our program, because I think faculty makes all the difference in a program. But as Dr. Ohana noted, so do innovative practices, and so does our responsibility to really continue to pursue the newest research about the field. And so to that end, right now I'm teaching a trauma-informed treatment class. There's an elective in our program, the first time we've offered it, and something that students seem to really be enjoying. I teach dissertation, I teach some sport and performance courses when necessary, but quite frankly, I teach any course that might be left over for me. I always try to assign courses to faculty based on their interest and their passion and their preferences. And because I have taught every course in the program to date, I seem to be the one that sort of comes up at the end and teaches whatever is left over. So students in the program can get me at about any time in their program.
Thank you so much, Dr. Cox and Dr. Ohana and Dr. Davis. So particularly this session, it was to, or it is to inform our applicants about this standardized patient program that we have available to them, that it seems to be unique of our counseling program. So if any of you can please sort of like explain a little bit about what the standardized patient program is, and how is it that our students, like when specifically is that our students will be accessing this particular portion of the program in their studies. And I'll just leave it open for whoever wants.
I'll go ahead and start the answer to that. And then if Dr. Ohana or Dr. Davis want to chime in, they're welcome to do that. So standardized patient programs are usually found in health science universities. They're most typically seen in medical professional education. The point of a standardized patient is that a medically, or in this case, mental health trained actor plays a client or patient for the student. The value of this is just multiplied, really. We are teaching specific skill sets, such as active listening or reflecting. And it's very intimidating, we know, for counselors in training to try to really hone in and focus on the skill development when they have to be worried about the potential impact of errors that they might make on an actual client. When we came and developed the program at University of Western States, they had a standardized patient program because we have a chiropractic program. And we thought it would be an innovative idea to train these actors to play mental health clients, long-standing mental health clients, so that our students could practice these skill sets on a person who really they come to believe is an invested mental health patient, but they get to take chances. They get to make effort to try things that they wouldn't normally try when it's an actual client. And the innovation is really key here, because I am not aware of any other counseling education program in the United States that is using standardized patients specifically in an ongoing way to train students. Primarily, we use it in a course called Pre-Practicum. Dr. Ohana referenced the fact that she's teaching a counseling methods course. That's where you first learn these basic skill sets. Then Pre-Practicum comes second to that, where you're actually assigned a standardized patient as an ongoing client. They are given an entire script that lasts for 6 weeks, so they know what to do, when to do it, how to do it. And as the student, you approach this as though, and you begin to believe very quickly that it's an actual client. And then we task you to engage certain of those skills during your time with that client, record those skills, and then we evaluate and give feedback about those skills.
Thank you so much, Dr. Cox. So I guess that takes us to the next question regarding the standardized patient program, which is the fact that, one of the most appealing aspects of our program is that it's 100% online, so people can actually log in and out of the learning platform at their convenience, so they don't have to move actually across the country to join us here, although they're very welcome to visit us. But we would like to know if it's safe, if it's confidential, what these students will do in the telehealth environment, and if we can have a little bit of an understanding of what telehealth is and the importance today. So, and I'll leave it open for whoever.
Dr. Ohana, why don't you start, and then we'll swing to Dr. Davis.
Sure. Telehealth and telemedicine has been evolving and is now a recognized practice and intervention and healthcare provision in our field. Online counseling safe and confidential? Yes. Yes, it is. And the benefit of it is that it makes counseling accessible for populations who may not be able to go into a counseling office for various reasons. Maybe it's a military deployment, maybe it's a geographical location, maybe it's they live in a rural area and they can't drive an hour into the counseling office. And as we have all experienced in the last 2 years, 18 months, maybe it's a world pandemic. They can't get into a counseling office. So that is the benefit to online and distance counseling and telemental health. It is safe and confidential through encrypted methods that are HIPAA compliant, and our program has taken steps to ensure that all of our training platforms and our classroom platforms are encrypted and are HIPAA compliant. And we have very strict procedures to make sure that students are in compliance, internship and practicum sites are in compliance, and then we as a university are in compliance. So I'll stop there and turn it over to either one of you who may want to comment.
I think Dr. Ohana was pretty comprehensive, so I really have very little to add to that. I think that telehealth is as she said, a thing of the future and the present. And many psychiatrists say that prior to COVID-19, they did very little telehealth type services, but now they do most of their work via telehealth, and they intend to continue that path. So we find that it's very, very effective, and very, as Dr. Ohana mentioned, it makes it much more, makes counseling services much more accessible to people who in the past may not have been able to access those types of services. So again, I think her discussion was very comprehensive, and if there are any other specific questions that may arise, we look forward to having those conversations in the future.
I would also suggest that we treat telemedicine, telemental health as a specialty area. It requires a lot of specific attention to affective changes that would be much easier to see sometimes in person in a traditional room-based setting. And because we were already teaching and engaging with students in role plays or in the use of these standardized patients, we were perfectly positioned when the pandemic hit for our students to transition to telemedicine. And we had already prepared them for the way to prepare their clients for telemedicine because we were requiring it in our classrooms. We were already preparing them to read affect differently than you would in person because we were already asking them to do that in our classrooms. So we felt very honored when, in the midst of this pandemic, our students who were placed in their internship sites in their communities were asked to be the leaders in their organizations to design telemedicine policies and practices to help the regular staff, the full-time staff, understand how to utilize telehealth. So we're really proud of our students in this regard and feel like It is our job and that we're doing our due diligence to help our students understand the implications and the practice of telehealth.
Thank you so much for that explanation. Very comprehensive. So that will take us to the next portion of our question from attendees, which is basically how does the licensure process work, specifically for people who are engaging in telehealth? So we know that after students complete our master's program, so they must go through a specific amount of hours that they need to meet as graduates, and also they need to take an examination so that they can work as licensed professional counselors in their states. So now my question is there a different kind of license that they need to use or obtain if they want to set up their own practice, like the telehealth practice, or is this the same license that they will be able to use for every kind of services that they could provide?
I'll start and everybody else can join in when you are free. So counseling is an unusual profession. Every state in the union has a different licensing board. Every state dictates what educational and practice requirements and licensure examination requirements must be met for graduates to pursue a clinical license in their state. And although we continue to work with organizations across the United States to move toward a national licensure, we don't see that happening anytime soon. So our program has been uniquely designed to try to capture the majority of states' educational, clinical practice, and examination requirements. And we provide a lot of that information inside our ethics course primarily, but all throughout the program. The question specific to telemental health is whether or not that requires a specific type of license. And no, each state has its own law related to what a clinician can or cannot do in regard to telehealth. For example, in Oregon, where Dr. Ohana and I both live, our state during COVID actually relaxed its laws and rules about providing telemental health, and now we can have entire practices utilizing telehealth and supervision of practice via telehealth. The trick is, and this is, I think, accurate in all states, but if not all, most states, you are not allowed to provide services in a state in which you are not licensed. So there is no national telehealth license either. If in fact you are not licensed in a state, you cannot counsel somebody from that state. I think that's probably the simplest answer.
Although I would add to that, that is the current policy and the current norm, but there's been such movement through the American Counseling Association and other counseling organizations to move more towards a national certification or credentialing process. I would imagine it will not take long, maybe 5 or less years. I don't know. I'm just estimating. I don't have any data to support that, but I don't think it's going to be long before we will see some sort of certification or some sort of movement in all 50 states to allow telemental health to go across state lines.
So do you have anything to add, Dr. Davis, to that?
I really do not. I think that's been very comprehensive.
Perfect. So I believe that the second, like another portion of this discussion around telemental health is in regards to the preparation for the exam then, so that students can become licensed. So I know that, in every single, when a student is admitted into the program, they're given a planner, and then they know exactly what are the classes that they have been taking, and then what classes are left in their program. But if we could have a little bit of an explanation in terms of how specific, like what specific provisions the program takes to ensure that students will be successful in this particular exam so that they can obtain their license.
I know Dr. Cox, since she is more familiar with the program, will answer or speak to this as well. The programs pretty much across the country, they know their students will have to prepare for and take the licensing exam. And so the courses are designed primarily through K-CREP and their standards to ensure students are getting if you will, the gold standard of what the expectations of a clinical mental health counselor is expected to do and know and be. And so by adhering to those standards, students are well prepared, and there may be some data that we'll be able to share relatively soon related to how successful our students are on the licensing exam. So I think most programs, again, across the country do collect data to ascertain how well their students are doing on the licensing exam, to see whether or not there needs to be some alterations in the program to ensure that the students are being prepared adequately. So that's my vantage point as I'm relatively, again, new to UWS.
Thank you so much, Dr. Davis. So do you want to add something else, Dr. Cox?
Yeah.
Yeah.
I think it's really important for any potential applicant to know that we want to prepare students from the moment they get into our program for their licensing exams. As a supervisor of clinicians, I'm often promoting the idea of taking their national licensure exam as soon after they have earned all their clinical hours as possible, and as soon after graduating their program as possible, because you don't want to lose the knowledge you just picked up as you went through your program. So what we do is sort of parse out that preparation. In every class but one in the program, there is a final exam. Now, lest anybody get distressed, they're really the only exams in any course that we have. They are all open book with no time limit. And the final exams are worth 100 out of 1,000 points that every course is worth. So not a major grade impactor. But the goal of the exams is to take content related to the topic that has just been studied in that course and relate it to potential exam questions about that topic that would be on the national exam. So the students get to the end of their course, and we're asking them questions that would be similar to the questions on an exam, so that they start making connections between the content that they're studying and what might be expected of them to know for this national test. And there are a couple of different tests, but that's our goal. So we're constantly thinking about how to prepare them for exams.
That is very wonderful. Thank you so much, Dr. Cox and Dr. Davis, for explaining that. So the next question has to do with another aspect that makes our programs unique, which is the sport and performance psychology component. If any of you can please explain a little bit about like how the sport and performance psychology content is incorporated into the clinical mental health counseling curriculum of our master's program, that will be great, so that our audience can understand a little bit of that sort of like combination between fields and transdisciplinary approach. And I'll just leave it open.
Okay, I guess I'm jumping in here. It's important to know that the history of our program is that the sport and performance psychology program existed first. They've been around for quite a while, and this program at UWS has been quite the trendsetter in the field. And one of the trends that was noted in that program very early on was that a lot of athletes and performers have mental health issues that are impacting their performance, their elite performance. Sport, acting, business, medical, doesn't matter what type of performance. And what they began to realize is that those high performers have difficult time getting access to mental health care. And why wouldn't we try to embed those skills in the sport and performance consultants that are already working in this setting? So when they invited me to come and design the program, it was originally with the idea that we would tuck it up under the sport and performance program. And because of that, from the moment we started designing this program, we have thought about how do we integrate the two fields? How do we consider sport and performance and elite performers while we are teaching traditional clinical mental health counseling skills and knowledge? And so in simple ways, we have integrated this content. For example, if we're writing a case study that we want a student to analyze that relates to a mental health diagnosis, we might use an athlete. And we might talk about that athlete in the context of their performance as a team and see if our students can cull out the differences between a performance-based issue and a mental health disorder that is impacting performance. We focus on this in every course in our program. How do students understand clinical mental health counseling in the context of sport and performance? However, it is not done in such an overwhelming way that somebody who wanted to come just for a straight clinical mental health counseling program would be offended or turned off or confused by it. You do not have to be in the world of sport and performance or to even value that field in order to be successful in the clinical mental health counseling program. But the opposite is true. If you really love the world of sport and performance, then a lot of what is written in our program is going to make sense to you as a sport and performance consultant or somebody who's already been working in that field.
Thank you so much, Dr. Cox. Is there anything else that you want to add, Dr. Ohana or Dr. Davis, in regards to the incorporation of sport and performance psychology into the counseling program?
The only thing I would add is that it's been fantastic working with students who have various backgrounds in sport and performance. And they find in my conversations with them that the program is so complementary with the sports and performance psychology program that it's extremely beneficial to their professional and personal goals. So in combination with Dr. Cox just said, the student experience is one that's highly valued and beneficial for them.
And I would just add that the paradigm in the counseling profession is wellness, that when we train professional counselors, we are training professionals to be wellness facilitators. In fact, that's what we should just call the discipline of professional counseling. And that's so congruent with sport and performance psychology. How do we achieve our very best self is very similar to the question, how do we achieve our very best performance? So they're very much aligned, and I love having students from all over, mostly the United States, but I've had students from all over the world in sport and performance, and I just think it adds such richness and diversity to our classrooms.
Thank you so much. That's very wonderful and actually very reassuring, because most of our applicants actually want to hear that. And that takes us to our next question in regards to this combined unique doctoral degree program that we offer here at UWS, which is the doctoral degree in sport and performance psychology with the clinical mental health counseling specialization. So if you please, Dr. Cox, could explain to us a little bit about who could be the people that should be ready to apply for this particular program. I know there's a lot of confusion. Some people who already have clinical mental health counseling licenses, they're looking at this wonderful doctoral degree and they're like, yes, I want to apply to this program. But there are certain provisions that we should keep in mind when we receive the application. And I was just wondering if you could share who are these applicants, who should apply for the doctoral degree in sport and performance psychology with the clinical mental health counseling specialization.
Thank you for asking that question. It's my very passionate soapbox topic, so I appreciate it. And just so everybody viewing knows, internally in UWS, we call this the integrated degree. So the Master's in Clinical Mental Health Counseling is the only clinical mental health counseling degree we have. You either enter a straight Master's in Clinical Mental Health Counseling program, knowing that as soon as you finish those courses, you graduate and you start working toward licensure, or you choose the path of earning your Master's in Clinical Mental Health Counseling. You have that degree conferred. As soon as those courses end, you can go out in the world and start working toward licensure in the field. And you continue on to earn a doctorate in sport and performance psychology. It's important that I say that because I want to make sure that our applicants know this is not a counselor education and supervision EDD or PhD. The actual doctoral portion of this program is sport and performance. The types of applicants that we tend to get are folks that have come out of the sport and performance world. So we have dancers, coaches, actors, athletes, Olympians, professional athletes, those who are already sport and performance consultants in major league teams. And we have traditional folks who've come out of a psychology program and wanted to participate in a master's and then found this passion for sport and performance and consulting generally. The trick when applying for our integrated degree is this. You have to feel a call to the helping professions. You really have to feel the strong inclination toward empathy, toward an ability to sit with people in significant pain. That has to be a significant driver or motivation for you for a couple of reasons. Number one, this is a long and rigorous program. So we're talking at least 4 years. Students will slow that process down and can take sometimes 5 or 6 years to complete the degree. That requires a drive, a motivation, and a tenacity. Then secondarily, we have an unusual field. We do not get to go home and talk with our partners and loved ones about the work that we do. Even though the world of sport and performance, and to some people, the world of counseling seems sexy, like, wow, this is cool, I want this flash. You never are the person who is seen, ever. We're always the people behind the scenes supporting, and we don't talk about our clients or our cases. We hear very difficult things, and unless we're talking to a supervisor or colleagues who are held to the same confidentiality standards we are not sharing the painful things that we hear. To be able to do that in the long term in our field requires a specific gifting and a specific calling. So in your application materials, if you can very clearly communicate how you feel called or driven to really be this kind of a helper, if it's all about flash and excitement in the world of sport or performance, we might not be the best fit for you, because we will dig and dig and dig to find out what that motivation is and to find out what your giftedness is and why that calling is important to you as we review not only your application materials, but as we engage our applicants in a long interview process.
Thank you so much, Dr. Cox, for such a wonderful response. Is there anything else that Dr. Ohana or Dr. Davis want to add to that? The kind of applicants that
I might just add, I think, we hear the language around this program as athletes and elite athletes and sport and performance, but not all of our students will identify with that language. For example, as I have a student living in inner city Washington, D.C., whose passion was to coach African-American young men and help them develop skills in sport as well as self-esteem and self-confidence through a nonprofit organization. So that's just one example of the kind of students that we attract and who this program is for. We are a program, as counselors, we see ourselves as advocates and social justice agents. That is a huge piece of our identity, and that is for all humans everywhere. especially folks that have experienced oppression or marginalization in their histories. And so we take that very seriously in our identity and desire students who want to go out into the world through sport and performance and mental health counseling and just being a part of the human race to go out and make positive social change. So that's my ad.
Thank you so much, Dr. Ohana. That's wonderful. Mhm.
I will really be brief and simply say that we know, as has been said already, that people who are in sport and performance arenas have problems. We all have problems. And so being able to have the clinical mental health background to identify some of those problems and be able to refer those individuals to other clinicians who will be able to provide the mental health kind of services in which they need is critically valuable. So, so yes, I look forward to looking at applicants who have the kind of passion and determination to provide a meaningful service to human beings, and whatever environment we might find them.
Wonderful. Thank you so much. So the next question has to do a little bit with, the hot topic, which is diversity, inclusion, and equity practices, and what Dr. Ohana referred to, which was social justice, and our approach as institution towards these particular issues. So if you want to tell us a little bit about, from your perspective as educators and also as counselors, so what are the things that you do in the program to ensure that each one of these topics get addressed in the curriculum?
Well, I'm going to start by speaking more generally, and then I'll let Dr. Ohana and Dr. Davis talk about examples of what they do in their own courses. But I'm super proud of our intentionality at this university to focus on diversity, equity, and inclusion initiatives. This is not just content we talk about, it's content that we engage personally. And our responsibility is to start with ourselves, our own self-reflection, and to have hard conversations internally and with our colleagues at this university about the ways in which we're successfully advocating for a diverse workforce and a diverse student population. To that end, I am extremely proud of the work that we have done with our faculty and our student body. We are the most diverse program at the university. 68% of our faculty members identify as having diverse backgrounds, ethnically and culturally. And we have the highest diversity population in our student body at 38% right now. And we are making provisions in our admissions and application process to ensure justice orientation when we're reviewing applications. A simple example of that is for somebody who may have a low GPA that is related to a social justice issue or lack of access to education or lack of access to quality education. We have an essay option where we will review the reasons for their low GPA and then include that in our decision-making about their admission to the program. So our approach starts from a very broad but important perspective about who we're hiring as educators, how they present, and how we are constantly focusing on new ways to be thoughtful about diversity, equity, and inclusion.
I would add that the university has recently demonstrated its commitment to diversity and inclusion and advocacy by hiring a full-time person who serves in that capacity. And when I talked with the president, he said he put the office right across from his office to try to indicate or symbolize how serious he takes that role and the responsibility of the university to respond to some of the kinds of societal and cultural issues that are affecting not only this country, but the world. And so candidly, as an educator, as I've said, it doesn't matter the complexion of the individual. we have a responsibility to provide meaningful services to all human beings and to remove some of the barriers and injustices that may have caused individuals to experience the world differently or in a disadvantaged way. So in the multicultural class, I think it's fantastic, the assignments and the responses from students. Right now, they're reviewing last week they reviewed an article on Trayvon Martin and how he died tragically, and the response from students has been phenomenal, primarily from a diverse student body, but predominantly a white American student body, and their response has been phenomenal. And I said to them, if you maintain that kind of compassion and passion for social justice and for humanity, there's hope. And so it's been again rewarding and refreshing for me to come to the university. And that's one of the things I said in my interview was the university has a diversity statement that says that they're just determined to attend a lot of those significant issues that continue to affect us. So I think it's something that the university takes seriously, and something that we must take seriously in order to again make it a more humane society for all of us.
I'll just add quickly, cultural competence and social justice and advocacy are standards in the counseling profession. It's just a foundation. We address these topics and intentionally bring them up, just like we bring up ethical and legal practice and our own self-care and wellness. These are foundational topics, areas of exploration and practice that are so ingrained in our identity as counselors, as professional counselors and counselor educators. And just really quickly, one of the questions was, how do you integrate culturally sensitive practices to treat clients, or how are these topics addressed in the classroom? So I would say in our standards, in our counseling curriculum standards, we are moving towards CACREP accreditation. So you'll see that in the learning objectives and assignments in the course, in our courses. I also think you'll see the faculty integrating and bringing up diversity, social justice, equity, inclusion, power, privilege, and oppression topics through discussions on discussion boards, through class interactions, through case studies. I know that just a quick for example, in my DSM-5 psychopathology course, the course has been planned with case studies, but I've asked my students to additionally consider power, privilege, and oppression, their own as well as the clients, in when they are giving a mental health diagnosis. In career counseling, we talk about access to career services, and even just the idea of being able to choose a vocation or a career as a matter of privilege. And what does that mean for populations who may not feel like they have that choice? So we weave this into everything we do, and this is part of everything we do. And as Dr. Cox said, this needs to be so foundational to your identity as just as a human being, but also as a counselor. And that is exactly the kind of applicant that we would seek for this program.
Thank you so much. Is there anything else, Dr. Cox, that you would like to add to that particular question about diversity, social justice, or it has been wonderful. So so I think we have reached actually the end of our session, and we really thank you, Dr. Cox and Dr. Ohana and Dr. Davis, for your participation during this panel. And now I'm just going to go ahead and talk a little bit about the admissions requirements, when to submit the application, what are the application materials. So you're just welcome to stay there and stop your videos, please, and just mute yourselves, or you can just leave the room. But in any case, again, thank you so much for joining me today, and I'll just proceed with admissions information then. Okay, wonderful. Again, so we are currently accepting applications for fall 2021, but also for spring 2022. So the final deadline for a fall 2021 is actually tomorrow, August the 20th, but our application process is very, very straightforward, very simple. So some of you actually have already started an application with us, and there are certain items that you have sent to our office. So we really encourage you to finish this personal statement with the prompts that we have sent out to you as soon as possible. But the most important piece is that you don't have to wait until your recommenders send their letters of recommendation to us. Actually, you can just enter their contact information, and then the system will send automatic reminders for them. So this is all good in that sense. So if you have unofficial transcripts available, please go ahead and forward all those materials to admissions@uws.edu so that we can start putting them together in your file. So the application materials then, a resume. So please just include all your professional background in it. Then there will be a personal statement between 250 to 500 words. Sometimes students or applicants actually include up to 1,000 words, and that's totally fine. There's a specific prompt that I have shared with all of you. So please go ahead and address that particular prompt. And then we will ask for official transcripts from all post-secondary institutions attended. So again, as I mentioned, we will use unofficial transcripts as placeholders. So just go ahead and send that to admissions. And then finally, we will just look through your application and make sure that you have successfully completed a bachelor's with at least a 2.75 cumulative GPA. So this is all that we will be asking in regards to the application for the master's program. So now for the application for the doctoral degree in sport and performance psychology with the clinical mental health counseling specialization. So you already know I have shared tons of information before this session. So you can apply to this particular doctoral program just with a bachelor's degree or a master's degree and a 3.0 cumulative GPA. If you have questions, if your GPA is not quite what we're looking for or what is stated in our website, don't worry, just go ahead and contact me via email. You also have my contact information, phone, and we can just go through different steps, but don't delay to submit your application just because you feel that your GPA is not gonna get you there. And so for the other application materials for this particular doctoral program or the integrated degree, actually, the application materials are pretty much the same. So we need a resume with your professional background, and we will need official and unofficial transcripts as placeholders in your application. We will need 2 letters of recommendation, and then there is a particular prompt that you will need to address that I have already shared with you in all my communications. But again, if there is anything else, please go ahead and let us know. So before I finish the session for all of us, so quickly, a reminder on deadlines. So for fall 2021, so we're talking about tomorrow, Friday the 20th. So go ahead and send your application. Currently, we are waiving the application fee. So if you're trying to submit your application and there is an issue, don't hesitate, just give us a call and we'll try to figure things out. And for spring 2022, you'll have until the first week of February to submit your application, but we are a rolling basis admissions office. So if you want to have an earlier response regarding admissions, please go ahead and also send that application before February so that we can process, and then you can just focus, if you get accepted into any of our programs, on securing funding for your master's or your doctoral degree. So if there are any other questions, please go ahead and send me an email. You can email me at lburbano, BURBANO, @uws.edu, or you can just contact the main admissions phone number, and then they will just transfer your call to me. The phone number is 800-641-5641, and I really thank you all so much for your participation during this webinar. And again, any other questions, please feel free to send them my way. Have a good afternoon. Thank you. Bye-bye.